Good afternoon, everyone. It is 4 o'clock on June 9th, and we will call our coronavirus ad hoc committee meeting to order now. Ms. Only, if you will please call the roll.
Yes, ma'am. McBride,
Present.
Livingston, Joe Walker, Barron,
Here.
Newton.
I'm here.
We do have a quorum.
Thank you. Our next order of business is the approval of our minutes. They were sent under a separate cover, also included as a part of the link for this meeting. At this time, I will take a motion to approve the minutes.
So move for approval of the minutes.
Is there a second? I'll second it. And if Ms. Only, if you will please call for the vote for the approval of the minutes.
Yes, ma'am. McBride,
Yes.
Livingston, Barron,
Yes.
Joe Walker, Newton.
Abstain.
Motion passes.
Thank you. Our next order of business is the approval of our agenda. Mr. Brown, before we move forward, are there any additions or deletions that you may have for the agenda?
No, Chair Barron, there are no additions or changes.
So
Thank
move for
you.
approval of the minutes.
Is there a second?
For approval of the agenda. Yes.
The agenda.
I'll second that.
Thank you. Is there any discussion about the agenda? Given none, Ms. Only, if you will please call for the vote.
Yes, ma'am. McBride,
Yes.
Livingston,
Yes.
Joe Walker, Barron,
Yes.
Newton.
Yes.
Motion passes.
Thank you. Our first order of business, we have several items that we want to take up under action items. So this time, Mr. Brown, I'm going to turn it over to you to give us an update, briefing, things of that nature.
Perfect. Yes, ma'am. So thank you, members of council, committee chair Barron. So we're starting right at the top with item A, 4A, essential workers pay. What I would like to be able to do is share some information with this committee and then hopefully get some feedback from you and then prepare a recommendation for this committee, considering both the information that we've reviewed and information that we gather from you on today, hopefully. So essential workers pay is something that under the American Rescue Plan is a applicable usage of those funds. So one of the things that we have done in trying to make sure that we capture those essential workers throughout Richland County, as well as workers who may not be, you routinely think of as essential in terms of their services, but during the pandemic, their work was essential for operations of the county to continue to respond and mitigate COVID-19. We want to make sure we capture those folks as well. So part of what we've done is we've reached out to departments to make sure that the criteria are met, that individuals were able to continue to work throughout the pandemic, and those persons were actually reporting to their workstations and carrying out the work of the county for the substantial portion of the pandemic, which would preclude individuals who were largely working remotely as a function of the changes brought on by the pandemic. So in short, if the pandemic hit and then I was able to work remotely and I worked remotely for the significant portion of the pandemic, then my position or my eligibility would not be included because of the constraints of the American Rescue Plan and the funding associated with maintaining the work and doing the work throughout the pandemic in that capacity. So that's kind of where Ms. Barron and committee members, we are working on trying to figure out whether or not it's going to be a one size fits all type of scenario. For example, if I could, let's just take EMS as an example. So EMS routinely had to respond to calls, to go out on scenes, to put on and don protective gear and potentially expose themselves to individuals who may have had COVID. And they had to do that routinely. That was not something they could do remotely. And they had to physically put themselves in that environment where there was potential known exposure to COVID-19. So that would be certainly one clear opportunity to provide some pay for an essential worker. But let's also consider, for example, and let's just use the finance office. So the finance office may not have had to go out and physically put themselves in known exposure areas of COVID-19, but members did have to come into and report to work in order to make sure the financial dealings of the county in terms of payments that had to go out to vendors, in terms of checks that had to be cut for employees, those are not things that could have been done remotely. And so they had to physically report to work on a daily basis to take care of those initiatives. So the question that we're looking at is one size fits all. So we're talking about making a recommendation to the committee and ultimately to council to provide a one-time stipend for these workers. The question that we're working through right now is, do we treat in a tiered approach, how we provide a stipend? So using the EMS example as one, do we say whatever amount that we're going to recommend, that those same workers get the same amount of stipend as a worker who did come to physical work every day during the pandemic because they could not work remotely, but they did not have to potentially expose themselves to COVID-19 in a way that maybe the detention center did. So these are things that we're working through, and certainly would like to hear some feedback from the committee. And certainly we're not asking you to make a decision for us, but I would like to, just utilize the resources that we have with other minds to think through how we might be able to equitably provide a stipend to show our level of appreciation and address the fact that folks did have to work in a challenging environment during COVID-19, especially at the height of the pandemic. So I'll stop there, Ms. Barron, and certainly take any questions or listen to any feedback that the committee would like to provide around this matter.
I definitely would like to hear from any of my colleagues that are present, those that are on the committee, and we do have a number of council members joining us today, and we do appreciate you all joining us for this meeting to chime in to hear your thoughts about a tiered approach when doing our appreciation to our essential workers, or a one-time stipend, or one size fits all. Any comments at this time?
Madam Chair.
Yes, Ms. Newton, you're recognized.
Thank you. And I'm calling from my car, so I can't raise my hand. But a quick point of clarification for Mr. Brown, two actually. One is, have the federal guidelines about this stipend been finalized, or are they still largely just strong guidelines? And then my second question is, either way, can you just share again what is understood of what the criteria are that have been provided by the federal government up to this point about what qualifies?
Sure. So, and some of this is, you can go back, and I didn't print that particular version out, but in that general document, it's been a couple of weeks ago that I provided, some of this information is there. But for the purposes of your answer, in terms of the premium pay or the pay for essential workers, that particular area is pretty much solid, Ms. Newton. The guidance concerning that pretty much communicates that there are certain sectors that were identified where these kind of like priorities, if you will, your infrastructure sectors, your healthcare, your grocery and food services, education, childcare, sanitation, transit, those types of areas where you may have had the need for services to continue to be provided, and workers had to provide those services. So in general, yes, ma'am, that particular section of the ARP is pretty solid at this point, and we feel confident that we can make a recommendation and be within the guidelines of the ARP if we did so before the closing period of additional comments and additional questions before they give their final guidance.
Okay, thank you. Then I will yield and see if my other colleagues have comments while I process this. But I guess first, just let me say that I think this is a wonderful opportunity to recognize our employees. And I do like the idea that we are expanding the idea of what an essential worker is. Absolutely want to reward those EMS workers who took on a yeoman's task to do that work. And at the same time, I know that, for example, our IT department, and I just picked them as a random example because I had to interface with them so frequently, were, burning the candles at both ends. They were everywhere to try to make it happen that we could continue to do county functions. So I do think it's great that we are expanding that definition. So thank you, Mr. Brown, and thank you, Madam Chair.
Thank you, Ms. Newton. Any further discussion or questions pertaining to essential workers and the stipend?
Yeah, Mr. Brown, I'm not clear on how we set the criteria, and I agree we may not want to do one fit all, but I think how we set the criteria to create different categories, though.
Yes, sir, Chair Livingston, and that's what we're working through now, to be honest with you, and that's why I communicated with the chair, Barron, that I wanted to, hear some other minds. We're working on this currently as administration, and we're looking at trying to make sure that there's equity in what we do, and that we don't take something that we're intending to be good and then turn around and offend people because they feel like we did not appropriately recognize them. So there's no specific criteria that the ARP is going to give us. It's going to be us determining whether or not, for example, and I hate to use this because I don't want to make it seem negative, but I'll tell you something that I said early on in our conversations that I think we definitely need to recognize. So when many of us early on in the pandemic, when the guidance said, if there's an exposure, you leave, you separate, there's 14 days, you go through this protocol before you come back and return. That was 2 weeks, that was at the height of the pandemic, where known exposures, you're supposed to isolate yourself, look for signs for 2 weeks. Well, when we were sending people away, we were calling in our operational services team. And we were telling those men and women, hey, we need you to come in and deep clean and electrostatic spray the areas where we believe there's suspected COVID-19 exposure. So those individuals are not routinely considered essential workers, but I believe that during the pandemic, they became essential workers because they were the ones responding to clean those areas that we believe and disinfect where we believe there may have been a known exposure. So in an example like that, Mr. Livingston, the question for me that I'm trying to work through with our team is that, okay, so we recognize that, we put them in an essential category, and we would recommend that to you as a body, but then do we treat that the same way that we would treat an Alvarez Glen Detention Center, or the same way that we would treat EMS or a patrol or the coroner's office? So while we support that, do we again say one size fits all, and then no matter what, if you had to work in COVID-19, you get this stipend at this level, period? Or do we say, well, there is a difference when the coroner's office has to go out and deal with a on scene and a dead body that may have, had COVID versus a office personnel who had to be in the office to do office work that had to be done, but their only exposure per se was limited to whether or not someone came in and brought in COVID-19 into the workplace. So that's what we're trying to balance, Mr. Livingston, and it's not an easy answer, but we're just trying to do the best we can and try to get some additional feedback from just yourself.
All right, thank you.
Mr. Livingston, are you finished?
Yes.
Thank you, sir. Ms. McBride, I see your hand.
Yes, thank you. I haven't had the time to deliberate as much as I would like to, but I'm thinking that if I see high risk, that those people that were actually, the workers that were actually exposed to a high risk of having contact with COVID, then I see those as essential workers, such as you mentioned, our EMS, the detention staff, the operational staff that had to come in and clean. And I'm not saying one way or another, I'm just talking right now, so, okay. But professional staff that had to come in, but they were not at a higher risk of contact, then I'm having some concerns about seeing those as essential workers because they still got paid their regular salary, or did their time that they work exceed the regular time that they had or are supposed to work? So I'm having problems in doing cross the board incentive pay, because there were those who were at home who may have wanted to come in to work, and now, but they were told that they didn't have to come, and then they are not being provided incentive pay because they were told to stay home. So other than those that we can definitely identify as essential workers that were at higher risk of being exposed to COVID, I think we need to identify that level of staff first. As a professional staff, you are expected to do extra work because of the salaries that you're making. So I'm sort of concerned with, based on your salaries, and if it was just coming to work and that there was not an extended amount of work, I mean, an extreme extension of work, then I'm having some concerns right now in justifying the pay.
Thank you for that, Ms. Barron. May I?
Yes, please.
Okay. So thank you for that, Ms. McBride. I totally hear that. And as we think through this, those types of comments are certainly helpful. I think that based off conversations that I've heard, and I know from various officials, the way they view what they had to do during the pandemic, as opposed to someone very easy to recognize like your EMS or a detention or a patrol, they certainly have a perspective where they see themselves as being put in a position to carry out the functions of the county during a time when their health was. So, and I just know that from them reaching out to me saying, hey, we're not detention center, but if we stop doing what we were doing, then the county would not be able to fulfill its obligations as a county.
Do I still have the floor?
Yes, ma'am.
And that's true, but you were hired to do a job regardless. So if you're performing the tasks and the responsibilities that you were hired to do, and you are not put at high risk, then that you are not put at high risk, then I'm having some problems right now seeing that.
Understood. Thank you, ma'am.
And if I may, I just want to say that after Mr. Brown and I've talked a lot about the essential workers and what that defines for us. And then I think that to Ms. McBride's point, yes, professional workers are still expected to perform because of the level or the capacity in which they were hired. However, we know and we've heard from several officials that, whereas they are professionals, and that maybe they were not placed at high risk, but they were placed at risk by there are individuals throughout the county that still reported to work every day while everyone else was working remotely. And so with that, they've now placed themselves at risk just because they have to come to work in order for the business of the county to continue. So as we continue to massage this, I want us to really just be open to those to what we would call non-traditional essential workers, but to really look at how this pandemic has changed how we do business and how those individuals that perhaps we did not see as frontline workers really became those individuals for us during this time. Mr. Malinowski, you're recognized.
Thank you, Chairwoman Barron. I don't need an answer now. I just throw this out there because I don't know what the qualification or what the requirements are to give this pay. But is this strictly for county employees, or would it also extend to individuals that are maybe contract workers for the county, such as cafeteria staff at the detention center, or possibly the people that are on contract to come in and repair the air conditioning and other electrical systems within our buildings that we own? I don't know if they'd qualify also. Thank you.
Mr. Brown?
Yes, thank you for that. And I will get the clarification on that, but my understanding is that it's both directly and indirectly. So it's possible that that could be the case, Mr. Malinowski. I will confirm that, but I believe that is possible if those folks were performing services for Richland County, much like we can do with grants. It's kind of the same thing, I believe, sir.
Thank you, sir. I just didn't want to leave anyone out if they're eligible.
Absolutely. Ms. McBride, I see your hand.
And would it be possible? I think there right now it's so vague. I need levels to really begin to determine. We have different categories, and at least that way we can look at the various categories and then determine how, whether it's going to be across the board or what. But if we had the categories, I think almost anyone would immediately say EMS, detention service workers, and you said the operational workers that came in and cleaned. And then to Mr. Malinowski's point, which I've always thought about our sanitation workers that are out there, and the cafe. I didn't think about the contractual people, but that's very important, Mr. Malinowski, at the detention facilities. I mean, we immediately know that those are high-risk areas, in my opinion. And then there's another category that you all mentioned that some may think that that's high risk. But in doing that, so that I think we're going to have to be very careful in how we maneuver this, because again, there were people who worked at home, told they had to work at home. But if they had known, they would have been glad to come in if they had known that they can get an incentive pay for coming in, but they didn't have that opportunity. So that's why I'm concerned about how this is approached and how we define the various levels of essential workers.
Thank you, Ms. McBride. And I know this conversation is just merely to do what we're doing right now, just to kind of flesh out some things. Mr. Brown and administration are working to provide us with more structure as far as regulations and the tier approach, so that we will have something that we can, really sink our teeth into and to look at. But this conversation is just to kind of get thoughts, from individuals. So Ms. Mackey, I saw your hand up. did you have a question? Or did you
Uh,
something to share?
Thank you, Ms. Chair. No, you kind of hit on it. I was just gonna say, just, everyone's chiming in that I was in favor of seeing a tiered approach, and that's kind of what you just said. So I think that's fine. We'll see it when the administrator brings it back. But I think a tier approach, based on all the comments I've heard, seems to make the most sense.
Thank you. Any other discussion or comments surrounding our essential pay?
No, and Madam Chair,
Yes, ma'am.
it was my understanding that this was for discussion purposes anyway. So thank you.
Yeah, absolutely. If nothing further, Mr. Brown, you may continue.
Absolutely, thank you. And I appreciate the conversation. I know that there are a lot of individuals who are interested in how the county will address this particular opportunity. One thing I will share with you around this item before I move on to B is that in conversations with members of current staff, one of the things that I addressed was questions of hazard pay, because this kind of really deals with this idea of hazard pay. And one of the things I communicated was that early on, one of the reasons that the county did not initially provide any hazard pay is because, according to the guidelines at that time, in order for the county to be reimbursed, you first had to have a hazard pay policy that you utilize in the event that a hazard is being mitigated. And the county does not have such a policy. So it was not a situation where the county was not trying to support its current employee staff, but it's not something that we had prepared for by way of having a policy. So one of the things that we'll be doing as well is looking at instituting a hazard policy that would help provide some future guidelines around this so that we won't find ourselves in this type of position in the future if we have to mitigate some type of hazard as an organization or as a group of individuals within our organization.
Ms. McBride, you're
Yeah.
recognized.
This is my last comment. As we look at hazardous pay, I think we need to be very careful in not doing it. Well, I don't want to say not doing it, but I'll say not doing it by percentages of salaries based on your current salary, because those essential workers, many have low salaries. So if you do a percentage, the amount of money they get would be much lower than someone else. So I would like for us to take into consideration, how do we determine the pay based on salaries?
Very good point.
Yes, thank you,
Thank
Ms. McBride. Thank you. You ready for me to move on, Chair?
Yes, please.
Okay, so the next section is the reopening plan. And what you have in your packet was largely the confines in which we were working under throughout the pandemic. Certainly things have changed from the time that we originally put this plan together. Some of the guidance over time has changed from the federal government in terms of the CDC, as well as our local providers. And so, but what you have is a draft of what we use to begin to try to provide a safe environment for our employees to work in during the pandemic, and to try to give them some guidance as to what we thought would happen over time. So certainly some of the dates in there, those are older dates, but in general, what you have is that's the template that we use to navigate our workspace throughout the pandemic, up until the point now where we are, at this space where, the numbers are totally different, and we're going to be looking at coming back into the workspace. So we're going to take from what we have learned, both the updates from the CDC, from OSHA, and we're going to update this particular document to reflect something that can be a living document that could apply. Hopefully we won't have it, but at least now in my lifetime, we've had H1N1, and now we've had COVID-19. So there is certainly a need to have something in place that can be a living document that we can refer to in times such as the ones we just experienced. but certainly we'll listen to any comments or feedback that you have from what you reviewed in the document and things you think that we should include as a part of our living document going forward.
So before I open it up to my colleagues, I just wanted to, Mr. Brown, if you could clarify this document that's included in our packet is the current document that you're working from as we are open now? And will this also be the document that you will continue to use once we're fully operational tentatively on July 1st?
Correct. So we will update this document to reflect current guidance, and we will try to structure the language such that it's a living, breathing document. But yes, some of the constraints that you see in here, we plan to continue for into the foreseeable future, especially as it relates to some of the screening protocols that are going to be in place concerning, temperature checks that's easy to do, some of the distancing that we have within the structure, the petitions, those types of things. We don't plan on removing those infrastructures. I really don't see us actually changing that.
So do you have an anticipated date you'll have a final document for us to review?
Absolutely. So in my mind, we have this meeting today, and I will be able to take a combination of what I hear from here, along with the updated guidance that we have. And I believe that as early as the following week here, so this not the end of this week, but next week, that I could have a completed document to council for their review and consideration for whenever you want to, if you decide you want to vote on it as a guide document. But yes, that is my plan, and that is that's what will happen. Let's just say it that way after the results of this meeting.
Thank you. Any discussion about the reopening plan that's located in pages 3 through 30?
Madam Chair.
Ms. Newton, you're recognized.
Thank you. Thank you, Mr. Brown, for providing this document. I do have a few questions about this, so I'll just ask a few and pause and then let other colleagues ask questions, because I do have quite a few. My first few questions are on page 3 of the document. You talk about a 25% maximum occupancy capacity for a facility. So my question is, number one, is that an OSHA standard, or where did that standard come from? And do you think that that standard is the one that you will be applying for July 1st?
So at the time, again, this document is dated. At the time, there were some guidelines that were given based on capacity that was being pushed out, both from the federal level and some recommended numbers on the state level. So some of those numbers were specific to persons, like literally, it was like no more than 10 persons in a group, that type of thing. So that information was really based on that. And no, ma'am, when we open back up, there's pretty much only one area, which is going to be on page 31 of your document that we're going to talk about. There's really only one area where we're going to be talking about a specified limit capacity for some time, and that is within council chambers, because that's an enclosed space where people will be planning to meet there for potentially an hour, 2 hours at a time. But no, ma'am, not in general. There would not be a general capacity limit for access to county facilities effective July 1st.
Okay, and so then I guess, I don't know if my other questions will apply, so maybe they apply to a different time period. So for example, here on page 4, it talks about promoting telecommuting and staggered work shifts. Presuming that we're opening up full capacity, that's something that's going to go away?
That is something that will go away as a general blanket rule, but we definitely know we have individuals who have high risk conditions And according to CDC guidelines and ADA accommodations, those things should be taken into consideration on a case-by-case basis and not dealt with from a blanket perspective. So telecommuting and remote work, where applicable, may still apply for certain individuals, but it will not be a blanket policy as it was during the times of the pandemic, where we were told to stay away from each other.
Okay, so then I guess if it's appropriate, Madam Chair and Mr. Brown, what would be helpful for me is I read this document as if this was the reopening plan and as if this was what we were going to use to reopen in July. So perhaps if you could hit the high points of, according to our current plans now, if I were to walk into 2020 Hampton Street or whatever the building is on July 1st, presuming that's a work day, what is it that I'm going to see? Because some of the information in this document, it sounds like doesn't apply. And so I would like to see a picture of the future.
Sure, and if you look at the phased approaches in the document, the phased approaches do talk about, kind of where we are now. So when you walk into the building on July 1st, as a citizen or as an employee, you are still going to be asked to do two things. One, you're going to be asked to be screened utilizing the technology we have, and you're going to be asked, if you are unvaccinated, to continue to wear a mask. So we're not doing a vaccination card screening or anything like that, but we are asking, following the CDC guidelines, for unvaccinated persons not to congregate unmasked with other folks in confined spaces. So you will see signage that communicates that we're asking you to wear a mask and that we are denoting that CDC guidance communicates unvaccinated persons should do that and follow that guidance. You will also notice that there is continued.
Gotcha. So,
I'm sorry, go ahead, ma'am.
Oh, so I was going to say, and sorry, when I read these documents, I start to write the questions on the pages when I have them. And so sometimes things might change when I get to the end of the document. So essentially what you're saying is I'm looking at page 15 of our agenda and or page 10 of your plan, which is what you would see as the state on July 1st.
Right, right. So we're at the phases of the plan that allow us to move forward with our opening. And so, yes, that's pretty much what I'm saying. You're looking at roughly on page 14 and 15, what we would consider generally phase 4 and 5, limited public reopening, which we already have done, and then full public reopening. Yes, ma'am. And in those openings, you still have mitigation strategies that are in place. And the difference now is, before, the guidance was strict and it said that individuals, but this is, had to have a mask in terms of the guidance, but that was before a vaccine. So that our document does not include vaccinations in there, but it still does include the downward trend of COVID-19 in the community, and it meets those criteria. But what we will be updating is information that reflects that, yes, we're still asking you to wear a mask. And I do know that, for example, if you're within a department and you're going to have persons from the outside coming in, that while those individuals may be vaccinated, we don't know whether they have a health condition where they can't wear a face covering. But when they come back into a smaller confined space, they will be asked, for the safety of the staff, to comport with those guidelines of wearing a mask, and we'll provide them with one while they're in a smaller confined space. So those are the types of things that will be different because of the new guidance, but we will still be wearing masks throughout the facility. We will be encouraging masking, and we will still be communicating that if you're not vaccinated, then according to the CDC guidelines, you are really supposed to have a mask on for public health purposes or a face covering.
Ms. Newton, did you have anything further?
No, thank you, Madam Chair.
Ms. English, I saw your hand. Was your question addressed, or do you have a question?
Yeah, 90% of it was. So I I know the thought process is asking them if they've been vaccinated, but I guess one of the things or one of the concerns I have is with the hate mail that we have received. How truthful is that? And does it matter as long as we have those protocols in place? But I think, Mr. Brown, you addressed that. So thank you for that.
Yes, ma'am. We're not going to ask anybody whether or not they have a mask. We're going to have signage that communicates what the CDC guidelines say around masking. But we're not going to ask anyone to prove that they do or do not need to have a mask on. As I've reminded people during the mask ordinance also communicated at the time that if you had health conditions that precluded you from wearing a face covering, then the ordinance allowed that. So we have never required people to provide health proof that they either don't have to wear a mask according to the ordinance, and we would not do the same thing for masks coming into the facility. I'll say one more thing, Ms. Barron, and then I'll start talking about this matter until you provide additional questions. But early on in the pandemic, there was a question as to whether or not the county would require individuals to be vaccinated. And at the time, there was actually no guidance to support the county's position, or I as the administrator, one way or the other. But now actually there is guidance on vaccinations. So to just go ahead and let the council know, I do not plan on requiring employees to be vaccinated as a condition of their employment.
Thank you, Mr. Brown.
Okay, I know you didn't ask me that, but I see that as a next coming question down the line. So I wanted to go ahead and communicate that now and give the council opportunity to discuss that and weigh in if they had thoughts about my decision around that.
Any further discussion, perhaps on what Mr. Brown just brought up, or the reopening plan for the county as a whole?
He's in line with the state and the city. Those are some of the things that we discussed today in the EMD preparation meeting. So no, he's right in line. So thank you for that.
So with that, we're going to move a little bit further into our reopening plan to talk specifically about council meetings, both our regularly scheduled council meetings as well as our committee meetings. And, you know, I joked about it a lot yesterday, but I think it might be time for us. And I've said it at our last meeting, if our administrator feels that it's safe for our county buildings to be open on July the 1st, I would like to encourage council to follow suit after that, in our first council meeting right after the opening, which would be July the 13th. And I'm going to turn it over to Mr. Brown. He's going to talk a little bit further about some of the precautions that staff will put in place for us as we begin to meet in person in the chambers, as well as during our committee meetings. Mr. Brown.
Thank you. And Ms. Barron, good conversation concerning, hey, Mr. Brown, you didn't include the council meetings in your reopening plan. And initially, it was not my understanding that that was something that the administrator would be able to determine, if you will. And so that's why that was not something that was originally included in the plan as to, when council would or would not do its business. So, but I certainly have understood that you all wanted us to weigh in. And what you have on page 31 is our initial weigh-in on that. And I want to talk to you specifically about what we have done to try to prepare for and to be proactive in our response to council meetings in the future. So on the document, what you will notice is that I talk about we are going to be requesting individuals that are coming into the council chambers for their council meetings. And if you meet other places where there is limited capacity in terms of seating and there's a lot of folks, the same thing would apply, in county facilities, that because of the enclosed space and the length of time that we generally spend in that enclosed space, then I am going to be asking that individuals go through the screening protocols, but that, yes, they wear masks in that environment, because we don't know who will be and who will not be vaccinated, and we don't want to give any tests to do that. So this is a way that we will be able to mitigate the continued spread of COVID-19 amongst those participants in that meeting of council members. In that council space, currently right now, with no restrictions, the capacity for the chambers is 141 people. Initially, I would think that the council would want to consider some limited capacity, maybe 50%, which gives you 70 people that could be in the chambers along with council during a council meeting, so that, again, you're not having individuals stacked on each other, while we know that currently right now in Richland County, less than, I believe the number is 43% of individuals are vaccinated. So if we're saying less than 1 out of every 2 people are vaccinated, then again, I know we're making assumptions, and yes, I am, then we're saying that 1 out of every 2 people coming to the chambers potentially would be unvaccinated. So we want to account for that, just because the statistical data says that that's what's happening. So that would be one mitigation strategy that you would have in place. And you may say, well, Mr. Brown, how would we then ratchet up more participation in the chambers? I would say to the council, either one, until DHEC or the CDC provides new guidance on the spread or mitigation of COVID-19 based on vaccinations or other tools, then you would then monitor the percent vaccinations within the county to determine how you're going to continue to allow more participation in council chambers. That would be the most objective criteria that I think you could utilize to determine how many more people you're going to allow in the chamber, and when you do it unmasked. So in terms of council members and participants, council members will have set in front of them petitions that should cover the front and both sides, so that they are protected, if you will, from individuals speaking to them and individuals speaking on the sides of them. So that was what will be on the dais. Individuals that will be staff who are sitting down in those seats, they will have a similar setup, and then the podiums will also have a similar setup. So that anytime people are addressing the council, there is going to be a protective barrier that prevents droplets from going beyond the spaces in which they are speaking. And we will have those spaces already disinfected and sprayed with antibacterial disinfectant to mitigate those droplets as well. So that's how we see the council chamber being utilized for in-person meetings. We also anticipate that, for example, we know from time to time rules and appointments, and I don't know if this will be the same going forward, would meet on the 4th floor conference room. So we're trying to get portable stations that could be set, taken down, that will then provide the same protections for all the participants in that meeting, whether those folks are being interviewed and they're sitting in front of a petition, or whether there's council members that are sitting in front of a similar front and side petition. Additionally, we have worked with IT to try to allow for individuals who cannot come into the chambers, who don't want to, or who don't still feel safe, to be able to access the meetings remotely and participate via the Zoom platform, but also participate as well. So that you would actually have an active live council meeting happening, but we will still have Zoom going at the same time, allowing individuals to still have that active remote participation. The other part of that is we're getting equipment that would allow us to have those meetings when we have off-site meetings, to again allow us to stream those meetings so individuals can have that participation activity from the streaming standpoint. So those are some of the things that we've tried to do in preparation for not only responding to COVID-19, but just going forward, being able to have that additional capacity for citizens who either can't make it to the meeting or who don't want to make it to the meeting, but want to participate remotely. So, and those are some of the things, Ms. Barron, and I'll just stop there. I know it's quite a bit, but I'll stop there to see what other information I could share or what other considerations the council feels like we need to take to create a safe environment for the council as well as those participants in the council chambers.
Thank you, Mr. Brown. Any discussion surrounding the reopening plan and council going back into chambers? Any thoughts or ideas that you would like to bring to the discussion? Ms. Mackey, you're recognized.
Thank you. Mr. Brown, you covered committee meetings. Was there any recommendations you had related to executive session?
Yes, ma'am. So executive session, and we've talked through this a couple times, and my recommendation would be that the council actually exits the chamber and uses the 4th floor conference room, and that we have our security staff outside of the room, making sure that there are no folks, trying to make their way up to hear or see what the council is discussing. The recommendation is that way because I thought about we're having people exit the chamber and then the council stays in the chambers. But in this day and age, even though technology is good, anything can happen. And I would hate for there somehow to be some type of snafu or some type of issue where an executive session of the council is recorded and broadcasted to the public. So that's why my recommendation would not be to stay in the council chambers, but for council to exit the chambers and utilize the 4th floor conference room, which is a broader space for utilization.
Thank you. And I'm sorry, can I have one more question, Ms. Chair?
Yes,
Thank
absolutely.
you. And that's the other one was, are there any recommendations related to public comment? So, if we're offering a streaming and in person, does that change how people provide comments? If they're there in person, will they be allowed to speak, or are they still submitting written comments? Has there been any thoughts to public comments?
So again, good question. And my thoughts are, if individuals want to participate and speak to the council, they will have the opportunity, as you are allowing participants to physically come to the meeting. If somehow those individuals are, they didn't make the cutoff, you're only allowing 70 people in, and they weren't one of the 70, that those individuals would still also be able to have their comments submitted through the medium that we're using now. And that will also be an additional medium for public comments going forward, not just limited to physical nature, but allow it to use via the online submissions.
Thank you.
I thought it's a recommendation that's certainly that I want to hear from the council as to, Mr. Brown, no, we're not doing that. We don't want that, but this is to me is a response to COVID-19, but then a next step that now as a council and as an organization, we are more communicative with the public, and the pandemic just brought it on.
Yeah, I couldn't agree with you more, Mr. Brown. Whereas we all are screaming about Zoom, but the one thing, it's definitely allowed us to be able to engage at another level and to encourage us to expand even further on the technology services that we do or do not have to service the citizens of Richland County. So I would agree with you wholeheartedly. Mr. Malinowski, you're recognized, sir.
Thank you, Madam Chair. Administrator Brown, in the past, there were other entities that used the chambers. Are those groups going to be allowed to do so again, knowing that it will actually cause additional work for you and your staff for the disinfecting of those chambers in between council meetings? And
Yes, sir. So what I would think is, Mr. Malinowski, as long as we can coordinate those meetings, one, ideally, we wouldn't have them on the same day they have council meetings. But if we did, that there's enough time that we will put a limitation on when the chamber could be used on that date. And I think that's something that in conjunction with you, Mr. Malinowski, as a council member, and along with myself, that we could put that out there that, hey, council chambers cannot be used on the dates that council meetings are scheduled until further notice. So that's something we can decide, but I certainly would not want to tell someone that and council feels a different way about that.
Thank you.
Any further discussion? Okay, Mr. Brown, we're ready to move forward with item 4C in
Okay,
providing
so-
us updates.
Yes, ma'am. Yes, ma'am. So program updates, we'll start with relief funds. Ms. Newton, thank you for your earlier question. I share this information with you all, just communicating that all final guidance has not been rendered. There is guidance coming out from the Treasury. We received some additional guidance not too long ago, but final guidance has not been given. But we do believe that we have some areas that we have identified where we want to go ahead and get the council to weigh in so that when we do get final guidance, things that are eligible and applicable, we can go ahead and address with the blessings of the council. So for example, we've already talked about just kind of one in general when we talked about the essential workers pay and that type of idea. I will share with this committee that we receive questions concerning, how can we use funds for sewer? How can we use funds for water? How can we use funds to address current facilities that we have that may have areas within the facility that may have infrastructure needs that will be applicable to ARP funding? So all of those things we are trying to vet through this process to see actually what can we use. And there have been some general categories where we're going to come to you and say, here are the things that we've identified. And then certainly we know you're going to have things that you're identifying, but we're going to come and say, based on the guidance, based on the needs that maybe some council have already pre-identified, we're going to put this back before you and say, we can begin to address these things. And then you can also add information that you want to address now. But I'll go ahead and give you one specific example that I'm going to ask the committee to consider right now. So let me find my language here. And the information that I'm going to share with you is in response to some of the lump sum appropriation groups that council has considered for fiscal year 22. And so I'm going to be, based on the guidance that we see in the ARP, we believe that we're going to have an opportunity to utilize some of that funding, which would increase the flexibility of the general fund and reduce some of the strain that we are putting on it. So Councilmember Barron, Chair Barron, I'm going to be asking the committee today concerning relief funds to move to use available COVID-19 preparation, mitigation, response, and recovery financial resources to fund fiscal year 22 council approved lump sum appropriation groups where eligible and applicable. So this is not a blanket approval. The groups would have to be eligible, and they would have to, the work that they do would have to be applicable to utilize funding resources that are provided to respond to COVID-19. And I use financial resources as a broad statement because there may be grant dollars that we can get, there may be ARP funding, there may be other funding that is not specifically tied to ARP, but it could include ARP funding, the American Rescue Plan funding, and that will allow us to address these things on a case-by-case basis and move funds to address those. So again, that's something that we think will be helpful. It will already address council-approved groups, and if the funding is not eligible to be used that way, then those groups will still get the funding that council already approved to the general fund. But if we can use other funds provided by COVID-19 resources, that frees up the general fund to be used for other purposes that the council may deem appropriate.
Madam Chair, can I speak in that?
Yes, you may be recognized.
Mr. Brown, and I've always looked at that as an alternative way too, but I would urge us to make sure we prioritize those lump sums that, if there are any that are, so that we won't have to worry about coming back next year without the rescue funds and trying to make up. There's some of those things that are 1 year and things, and I think if we did those first, we'd be better off for the next coming year.
Okay, Mr. Chair and Chair Livingston, and my thought was that this is specific to fiscal year 22. This is not a blanket approach for the.
Right, we want to make sure that's clear, but it's easier for that to happen if it's someone who requested funds for this year though, for 22. You know you have to worry about them next year.
Yes, sir. I think I understand what you're saying. You're talking about groups that have maybe requested for multiple years, and them thinking that going forward, because they were awarded this funding this year, that they may automatically be on the line to receive funding for fiscal year 23.
Right, and that may create a problem for you.
Understood.
A question for you, Mr. Brown. With your motion, if the individuals or the organizations were not approved in the FY 2022 budget, do they still have an opportunity to seek these funds as well?
So, Ms. Barron, you always do this to me. You always take it to the next level, and you make me have to talk about something I don't want to talk about. You ask the question, I will have to respond truthfully. So the idea is that the staff was going to come back to the council or to the committee and say, we have identified that ARP funding, these groups we know that are eligible. And to a point that's made by Ms. McBride, it would not be incumbent upon the groups to come to us. We would actually do outreach and identify groups that would be eligible for this funding, and then come to council and say, we've identified based on the ARP guidelines that these community groups are eligible. Do you want to fund any of these groups? You would then say yay or nay based off what we are providing to you. Then from there, we would go back to the groups and say, council has identified you as an eligible group and is interested in providing funding. Here's what we need from you to support providing a funding recommendation. Then dollars will then be coming back to the council to determine how much you would want to support these groups based off what they're capable of doing with the funding.
Very good, very good.
So I didn't want to get out in front of the other stuff, but you asked the question, and that's
Yeah.
where the outreach comes in from staff to the community, and not the community having to say, I heard about and I'm applying for knowledge that the county has available.
And I think that, as we are in the heat of our budget discussions, this does, help us to further broadcast and to be able to, or forecast things that we're looking to fund, or perhaps we're not able to fund. Ms. McBride, I see your hand.
Yes, ma'am.
You're
Thank you.
recognized.
I guess one of the concerns I have in terms of the budget process is that it's how we word the motion or how we approve it, so that we don't approve, suppose somebody wants $300,000, and we know that it's a possibility that they can get the funding through the federal government, through those funds, but through the relief funds. But we have to be careful not to approve that during our budget process, because then we'll obligate ourselves to that 300,000, even though in case they can't get the money through the relief fund. Are you following me?
Yes, I follow.
You understand what I'm saying, Mr. Brown?
I believe so, and we are limiting this, Ms. McBride, to what the council has approved.
Right. But suppose we approve that 300,000, thinking that they would be able to get some of the relief money. And then it comes up that they can't get the relief money. Then we're there with the $300,000. And I would not have voted on it had I known that they couldn't get the relief money.
Right. And
So go
I'm
ahead.
sorry.
Go
I was
ahead.
gonna say, Ms. McBride, I believe I completely understand now what you're saying. And our intent is not that this is based off if you're eligible for the funding. This is the council has approved XYZ community to get general fund dollars for $200.
Mhm.
And all we're saying is we want the council to give us the flexibility if there are other financial resources that we can use to give that $200, let's do that rather than use the general fund. But this is not an if then.
Okay,
This is only what you approve with what you expect to spend from the general fund.
okay, so I would say the motion would be to deny a lump sum funding, but that you may be able to use some of the some of the relief funds, some type of contingency plan for, even though we denied the lump sum appropriation.
If someone was denied, Ms. McBride, they would not be included in the motion that I am asking council to make.
Okay. Okay.
It would only be for those groups that you've already approved and you thought you were going to be using general fund dollars. If we can use COVID dollars in some shape, form, or fashion, and they're eligible and they are applicable, then we would simply swap out those dollars.
Okay.
It would not require council to take a different action.
Okay, because see, there are some that I'm thinking of now that I would only approve if that they could use the relief funds, because I would not approve for them for the lump sum.
We're not asking that. Please don't make a decision with the if possible. That's not what we're asking.
Okay. Okay, with that understood. Thank you. It was another question, but I forgot. So if it comes back, I'll let you know.
Okay, yes, ma'am.
Sure. I'm glad you cleared that up. Ms. McBride, it was an excellent question because I was thinking the same thing. I was putting strategy in place in my head. So I'm glad you cleared that up. Ms. Teratio, you're recognized.
Thank you, Madam Chair. I guess I have a very, I guess my question was close enough to Ms. McBride's. I'm trying to think if there could be a mechanism by which, we could say, yes, we would absolutely love to fund this entity. But we know that we can't, but we know that the best way to, possibly the best way to fund them would be through ARP funds. Is there a motion that could be made, or could that be made separately outside of the budget?
I would say, Councilmember Teratio, if you want to go down that line, what I would request from any council member is that if you have a group or groups that you believe that you're looking at in that vein, that we run those through the prism of the criteria and then able to share with you whether or not we believe at this point the guidance is clear on whether or not these groups are applicable. Because remember, in roughly about another 35 days, we'll have final guidance. And so we'll have an opportunity to know better, and we'll be able to provide you with whether or not these groups are eligible for this funding, because that's going to be something that's going to be on an individual basis to make sure they meet the criteria that's outlined to get these dollars. So I would caution us, and I know I don't know. I believe we're trying to be very helpful in a blanket way, and we want to do that with this program. It's going to be targeted to make it's broad enough to capture a lot, but it's targeted to where we have to make sure that we expend the dollars in conjunction with what's eligible under the guidelines.
Okay. So if we think that there is a group, let me just see if I can recap so I'm understanding correctly. If we think that there is an entity that does the kind of work that is outlined as potentially to be funded through American Rescue Plan monies, we could submit that entity to administration and maybe Director Hayes and just kind of get some feedback on that.
Correct. So we could vet that and tell you what we know today about the eligibility of their group potentially receiving funding from the ARP. Correct. But I would not make a general motion at this time regarding any of those, because it's going to still require some vetting. And I think that if you make a motion that way, folks will think that automatically they should get it, and that something trying to prevent them from getting it.
Yes. So we definitely want to be transparent and honest and fair with everybody around expectations and that sort of thing. So thank you for your guidance on that.
Yes, ma'am. Thank you for your question.
Mr. Recio, are you finished?
Yes, that's it for me. Thank you.
Thank you. Ms. McBride, you recognize.
Thank you. I remember my question. I'm concerned about the how we're spending the American Rescue Plan funds. And as with anything, I always, as you, Mr. Brown, you know, we talked about strategic planning and establishing priorities. And I don't want staff to have the authority to come up with the recommendations to submit to council. I don't want just this committee by itself. I think that there needs to be a plan processed in terms of our priorities based on the guidelines in determining how we're going to use these funds. And so that's one of my concerns. And I think that we need to have input from the county, from the constituents, from the businesses, whatever. We should not make this decision alone, staff or the council, without some type of active input and developing a plan. That's just my what I think about the process. Thank you.
Thank you, Ms. McBride.
Madam Chair, may I add some comments? And this is not a response, it's just to Ms. McBride's point. There are some steps that I believe the county is going to want to take in using these funds, which require public input. So, but for example, one of them is not whether or not we provide a stipend to our identified workers. So that would not be an area where you will be required to receive public input on your utilization of those funds. But there are going to be some projects that do require the county to get public input on how it is expending or is considering expending ARP funding, or before it expends ARP funding.
And I understand that there's some areas, but I think that there needs to be, that's the $80 million that we're to get, Mr. Brown.
Correct. Yes, ma'am.
So we've got $80 million. I don't want the information just coming from staff recommendations on how to spend it. I just think, and I would like to see the guidelines myself to look at it. But I think that we need an opportunity. There should be an opportunity to have input from other stakeholders. And I'm saying input.
Thank you, Ms. McBride. Mr. Livingston, you recognize, sir.
Yes, and I like for us to probably think about some broad categories to focus on, whether it's food insecurity, trauma, mental health, whatever, just whatever it might be. Come up with some prioritization in terms of broad categories that we want to focus on that's related to COVID.
Yeah,
sir. Madam Chair, may I ask a question to Mr. Livingston?
Yes, you recognize.
Chair Livingston, in hearing what Ms. McBride articulated, would your statement be something that would come from staff, or how would we get those broad categories?
I think council ought to think about some broad categories that the staff to look at as well.
Okay, thank you, sir.
And also to that point, Mr. Livingston, Mr. Brown and I had already started doing some brainstorming of some projects that we wanted to bring to the body, but what we don't want to do is to bring things before the body and it's not an allowable cost without having the final guidance. So we've had some conversation, and I totally agree that we need to set forth some priorities that will wrap around this funding to push the county forward in this time, because it's a great thing that we have these funds, that we can do some things that perhaps we would not be able to do had we not gotten them. Ms. Terratio and then Ms. McBride.
Thank you, Madam Chair. So my question, I guess, is are we envisioning some kind of possible work session, possibly with some stakeholders being brought to the table? Would that be something we're thinking of down the road?
Ms. Terratio,
yes.
that question is for me, based off what I'm hearing, that may be part of it, but I think for a larger context, as it was brought up by Ms. McBride, it would probably be better to get greater clarity from Ms. McBride's perspective.
Ms.
Okay,
McBride.
thank you.
Yeah, I think, as I previously stated, that I think that we needed more stakeholder involvement, similar to what we did with the flood funds. That's only input from the stakeholders, because council will make the final decision with you, Mr. Administrator. But I do think that, because I'm not pleased with some of, let me take that back. I just think that we need more stakeholders involved in the process. And I think that there needs to be a plan, and a strategic plan in how we're going to expend these funds. And I also think that I would like to see, others may not, but I'm used to reading grants and big guidelines. I would like to see the guidelines on this funding.
Yes, and Ms. McBride, I think that there was a document that was sent out from the Association of Counties. They did send out a briefing document with the guidelines there. I've started and kind of skimmed them over a bit, and there's also I think they're hosting work sessions and on to give you updates. And
I'm aware of that, Ms. Barron, but I want to see the guidelines that the council gets, that the administrator get. I read all those things that come through the emails and all. I want to see the same guidelines that they get. Thank you.
Mr. Brown, can you make those guidelines or the guidance available
Yes,
to
ma'am.
council?
I can. I believe some of them would be duplicative, but that's, so that just letting you know that I'm getting some of the same stuff that you're getting is what I'm saying. But we will share with you all the guidance that we have received to date relative to the American Rescue Plan and the various COVID-19 relief aid funds.
And Mr. Brown, why I'm asking that is because there are constant updates coming out. So what I read last week may be different from what you're following this week. And that's why I prefer following along with yours. Thank you.
So if you will, Mr. Brown, as you get updates, if you'll pass it on to council.
Yes, ma'am.
Thank you. Ms. McBride, did you have something else? Okay.
No, ma'am, I'm finished. Thank you.
Okay. So Mr. Brown, if you will, you gave us a detailed, you gave us a report last night on our ERAP funds.
Yes, ma'am.
So we can skim right past that. And if you would give us just an update on where we are with the FEMA site. I know we're coming down to the last couple of weeks, but if you could provide the committee an update there.
Perfect. So the site, in terms of the FEMA coordination, that part of the site has ended. DHEC has, we've entered into an agreement with DHEC. You may have remembered the deputy incident commander talking about them continuing on the site for an additional couple of weeks through I think the 26th of June to provide additional shots for appointments that they had for second doses. So that I did sign that agreement, and that is still going. Also, I did get the final numbers as of June 8th. So total vaccinations at the CVC site, or the mass vaccination site, were 21,295. Of that, 17,392 are Richland County residents. So 81.67% of the folks that went to that site were Richland County residents. So I got those numbers today from the deputy incident commander that we had participate in our last meeting, Mr. Randy Stewart. And those numbers are up to date as of June 8th. So those are the updates related to that site, Chair Barron.
Thank you, Mr. Brown. If we could, I sure would like for us to just sing our praises throughout social media or with a press release to just kind of encapsulate the FEMA project. I know EMD is probably, I've seen that they've done some things, but it would be great for us to also show the support that we were a part of this event, and largely the majority of the residents or largely a number of individuals who came through this site were from Richland County. Whereas our numbers, our vaccination numbers are at 43%. We did have, had we not had this FEMA site, we may be even lower. So I think it would be to our advantage, and definitely the community needs to know the great things that Richland County is in partnership with. Ms. McBride, you recognize.
Yes. I guess this is for Mr. Brown. Are we be doing anything to encourage and provide or coordinate with others for vaccinations for people in the very, very high-risk areas that are not being vaccinated, the ones that, I forgot the terminology they call them, the ones that have not made up their minds. And I know on a national level, they're doing some things that we've talked about and I pushed before with the barbershops and the beauty salons, and actually going to the committee. Will there be any type of mobile vaccination stations, or are we doing anything to increase the number of people getting vaccinated? Because South Carolina still remains at the bottom in terms of vaccinating its citizens. And we still have a high percentage of people in our lower income areas or hard to reach areas that are not vaccinated.
Yes, ma'am. We are willing to partner with really anyone, Ms. McBride. And there had been some messaging that we were with some of our partners that said that they would be going into the targeted areas, utilizing, for example, mobile sites. But it is something definitely that we would have to partner with, because we as a county do not administer shots, but we certainly could lend our support, whether it's some level of financial or some other support to those initiatives. And so, yes, ma'am, we are willing. We've made that known. And if you have anyone on the call right now who has personnel who are looking for access to connectivity to me to help, get something off the ground, please share my information with them. But absolutely, Ms. McBride, we are willing to continue to collaborate with any of our local partners to do that.
Okay, and thank you, Mr. Brown, for that, because I still think that we have not reached a number of people in terms of the rental assistance. And I know what we're doing the best we can, and staff, they've done a good job given what they had to do and the outreach methods. But I still think that there's more that we can do in terms of maybe piloting some programs within, because we have until the last of September, is that correct? Trying to get that relief money to those that need. I've mentioned this several times, at least to try and pilot some programs and to try and get and reach as many people as we can. As I stated before, many have already been evicted, and there are still others that are out there that need assistance, but they're just hard to reach.
Yes, ma'am. Just to answer your question about the dates, we actually have until the end of December of 2021. We have until the end of September to spend 65% to be considered a fast spender and potentially receive more dollars rather than having our dollars taken away. In the 2 months that we've been doing this, we're actually above 35%. And I know, again, I'm not saying there's not more that can be done. That's not what I'm saying. I'm just saying that if you, and I'm trying to be cautious of how I say this. I know you talked about looking at South Carolina not as a measuring tool, but I would just say that as we look at what we know, that our 670 plus individuals who have received over $4 million in rental assistance and utility assistance, while we can certainly do more and we want to be able to do more and we'll be doing more, it's still a significant help. And so I acknowledge what you're asking, and we'll actually be spending some time with you on your thoughts on how we can utilize funding that we have to possibly gain access to some of the folks that you see as us still missing. But I certainly want to just communicate and acknowledge what you said about the current state of the program, that it is really good, Ms. McBride. And so I know you're saying that it is, but you want to see more. And I just want to make sure that I acknowledge to the team that that program is really rocking. And if you look at us compared to, again, I hate to do it, not to do it, Ms. McBride, the state of South Carolina has all the counties but 7. We just have Richland County. And in 2 months, we've given $4 million. You're not going to find that with similar sized counties. And I think that that's just something to be said. And so we're starting from somewhere and we're going to try to get better than the nation. But right now we are certainly, we're ecstatic that we've been able to help a number of people in Richland County, and we're going to help some more.
Yeah, and Mr. Brown, I don't want to take anything away from the work, the tremendous amount of work that the staff has done. Please know that I don't want to take anything away from that. So, and when I make my comments, it's not the staff is not doing a good job. I just know that there's more. I feel that there's more that can be done, but I know that the work is very difficult in being done. And that's why I want us to try. I'm not saying what I say will work, but at least let us try to reach more people, because I guess my issue is people are looking at it differently from the way I look at it, because it's an emergency. But when we look at it over months and months and months, it doesn't become an emergency fund. And that's just my perspective on it. So that's why I think it's so important that we try and reach as many people as we want to. And as the time goes by, we just lose people. The emergency becomes the end. So, but I do want to take this time, Madam Chair, to really thank Mr. Brown and his staff for the work that they've done, and for them to know that I appreciate the work that's been done. So if I seem a little hard, it's not that I'm not appreciating the work. I just want to do some more different types of projects. Thank you.
Thank you, Ms. McBride. And we know, and I'll say, I know personally, your heart is with the community, and that's where it should be. Because we're here to serve. We're here to get these funds out as quickly as we can, as efficiently as we can. And the staff have done a great job, and we're going to keep pushing it in hopes that, what we're doing is working. But if we can find some other means that can turn it up even a little bit more, I think we're open to conversation. While we were sitting here having a conversation, I came up with a brainstorm. So Mr. Brown, I'll call you with that. And maybe it'll work. I'm like you, Ms. McBride, maybe it'll work, maybe it won't, but it is an emergency. And that's why this committee is formed, or this committee is formed, because we are in a state of emergency, whether individuals think it or not. We're still here in this state of emergency, and we're addressing the needs of the citizens right here in our backyard. Mr. Brown, do you have anything further that you would like to share in your updates?
No, ma'am, that's it. And I think that we'll end on that good note from my side, that We appreciate the acknowledgement. I know we have some men and women on this call who really appreciate the support of the council when we go out and try to serve the community with these initiatives. And they are equally as ecstatic about trying to drive a better quality of life for our citizens.
Absolutely. So with that, our last order of business is adjournment. Is there a motion
So move.
and a second? It might just be me and you here now, Ms. McBride, so I'll second it. Miss Only, because I know Miss Newton had a previous engagement. Miss Newton, if you will, Miss
Second.
Only. Oh, there's a second now. Thank you, sir. So Miss Only, if you will call the vote for us to adjourn.
Yes, ma'am. McBride,
Yes.
Livingston,
Yes.
Joe Walker, Barron,
Yes,
Newton. Motion passes.
thank you all so
Thank-
much. Our
thank
meeting
you.
is adjourned and have a great afternoon. We'll see you soon.
Thank
Same to you.
you.
Thanks.
Thank you, Madam Chair.